Body systems. The skeletal system is the first body system to look at. It includes the bones of the skeleton and the cartilage. The functions that the skeletal system provides is it supports the body, protects the organs, produces red blood cells, provides an attachment for muscles, and gives the body flexibility. The dental function, primarily the teeth are located in the bone. The alveolus is the socket that the teeth are in within the bone. The mandible is the lower jaw. It's on a hinge so that the skeleton can open and close the mouth, and the hinge is the temporal mandibular joint. The maxilla are the maxillary or upper teeth, and that's the bone those teeth are located in. The muscular system includes both skeletal muscles, which are considered to be voluntary, and cardiac or smooth muscles, which are involuntary. The skeletal muscles, the voluntary muscles, are considered voluntary because you choose whether or not to move those muscles, whether to raise your arm or walk or turn your head. The cardiac and smooth muscles are involuntary because they continue to work whether or not you're consciously working them. For example, the primary thing would be the heart. It beats whether or not you think about it beating. So it's involuntary. The functions for the muscular system are movement, but also heat. So as you move, you heat up the body, so it keeps the body warm. If you ever think about when you're cold, you actually start to move around. You bounce a little bit or jump around or do something, and that's the muscles actually heating the body. The dental concerns or considerations for the muscle system are the various things that we can do dentally or in the oral cavity, one of which is important function is deglutition or swallowing, also chewing or mastication, muscles of speech so that we can speak, and the facial expression muscles, smiling and frowning. The nervous system includes the brain, the spinal cord, and the nerves. The functions of the nervous system are to respond to the environmental stimuli quickly. Ouch, I burned myself, or I hit myself, or something. You respond very quickly. The nervous system regulates all body activity and learning and memory functions. For dental, we look at the major nerve that affects the head and neck, which is includes the trigeminal nerve, a nerve that comes down from the brain and affects the eyes, the maxillary teeth or the maxilla, and the mandibular teeth. So it's how we get feeling in our teeth. We use local anesthesia to block the nerve transmissions or the ability of the nerves to transmit pain or feeling sensation to the brain. The endocrine system includes hormone glands. Its functions are to secrete hormones for regulation of body chemicals and to respond to stimuli slowly with long-lasting results. So we talked about the nervous system where that responds to the stimuli quickly, and the endocrine system responds slowly. The dental significance, the thyroid gland, we always are careful about using the lead apron with the thyroid collar when we're taking x-rays so that we can protect the thyroid gland. And one of the health conditions that is greatly affected by the endocrine system is diabetes. And the patient who has diabetes has quite a bit of dental problems, so we're always aware of our diabetic patients. The nervous system and the endocrine systems work together to coordinate functions of other systems. The nervous system is quick response, the endocrine system is slow, long-lasting response. The reproductive system includes, for the male, their testes, ducts, and the penis. For female, ovaries, uterus, and the vagina. The function is creation of offspring or reproduction. In the dental world, we are concerned, obviously, if our patient is pregnant, we want to be careful about using x-rays, about taking x-rays very cautiously, if at all. Some of our patients, when they're pregnant, get a condition that's called gingival hyperplasia, which is where the gingiva or the gums swell and get very inflamed. The condition usually goes away after delivery, but it can cause some problems during the pregnancy. And then the diet of the patient. Sometimes they have a lot of nausea. We want to be sure that they're getting good nutrition. The nausea, of course, if it's causing vomiting, can add acids to the teeth and maybe do some damage. For males, we also want to be careful that we don't radiate their reproductive area because it can create anomalies in their offspring. Both for both females and males, the reproductive area is protected by the lead apron when we're taking x-rays. The circulatory system includes the blood, the heart, the blood vessels, and arteries. Its function is to transport nutrients and wastes from the cells. In the dental office, again, we're concerned about the circulatory system. Sometimes we have to pre-medicate the patient with antibiotics if they have certain heart conditions. We have to check our patients if they're taking any anticoagulants. We want to be sure that if they're having surgery, any kind of dental surgery, that they're off of those anticoagulants. That might be your stroke patient who's taking that. If that's the case, then you have to work closely with their physician. If a patient indicates that they have high blood pressure, we want to be careful that we're using the non-epinephrine anesthesia so that we don't aggravate their heart condition at all. We check the blood count prior to oral surgery, and we check vital signs, the blood, the pulse, and the blood pressure. Digestive system includes the mouth, the teeth, the esophagus, intestines, stomach, and liver. The function for that is to process nutrients and excrete wastes. Dentally, digestion begins with mastication, which, as I said earlier, is chewing. So as you are chewing your food, you're actually starting the digestive system. Some of the chemicals in your saliva begin breaking down the food right at that point. A patient who has pain in their teeth or is missing teeth cannot chew properly. So that affects their nutrition, and that can affect the whole digestive system. The respiratory system includes the lungs and the trachea. The function is to exchange gases so that we get oxygen into the blood and the carbon dioxide can leave the body. In the dental concerns, we're concerned about mouth breathing. Sometimes patients can't breathe as well through their nose and they have their mouth open all the time. That can cause some complications in their oral cavity. Dry mouth, and also then that can lead to some problems with decay. The lymphatic and immune systems includes the lymph vessels and the nodes and the spleen. The function for this is to protect the body from disease, drain body fluids, and absorb fats. Our dental functions is that we want to be sure that we protect the lymphatic system from radiation. The lymphatic system produces fluids at the site of the infections, and that little area, it looks like a little pimple, it's called a fistula, and it's really an area where the pus from the infection can drain. The tonsils can become inflamed or enlarged, making it difficult to treat the patient dentally. If a doctor sees that a patient has enlarged or inflamed tonsils, chronically inflamed, they often refer them to a physician for further treatment before doing any extensive dental treatment.